Good morning, everybody. Thank you for joining us today. It's July 25th, 2025. Please note this event is being recorded and will be uploaded to the Career USA YouTube channel for others to view in the future. By participating in this event, you give consent for your name and picture to appear. Please note that any comments you put in the Zoom chat window will not appear in the recording. Well, good morning, everybody. My name is Jeff Morris. Back in 2007, I started facilitating and leading the North Dallas Plano Career Focus Group. This group's been around since the late 1990s. I took it over in 2007 when the prior leader landed a job. In 2008, I started a website called careerdfw.org, a website to help those unemployed in the Dallas-Fort Worth area. In 2012, I launched careerusa.org to help those around the United States. I have written a book called What I've Learned About Your Job Search That You May Not Know, thanks to somebody in the last 90 days who bought a copy, because I got a notification that somebody bought a copy online. Thank you. I do have copies with me if you ever want to just buy from me directly. And since 2017, I've been a member of the practice interview team, also known as PIT Crew, and you'll hear more about them in just a moment. Our agenda this morning is we'll start out with success stories, job leads, 30-second introductions. We'll have everybody here in the room give their introduction first, and then we'll go online and grab everybody who's online. We'll hear then from the Interview Success Workshop, the Practice Interview Team, and the Career Tip of the Week, and then our main event about the top of the hour. So we'd like to start the meeting with good news. Do we have any landings to announce? Nobody came in with donuts here, so any landings? Anybody online landing? All right, well, we'll move on then. Okay, would like to, everybody who's online, if you open up your chat box in the chat window, please put your name, the position you're looking for, give us your email address, your LinkedIn address, your phone, what city you're watching from. Give us 2 or 3 target companies that we may be able to help you with. And then if you have companies where you have connections and you can help somebody else, please let us know about that. I'll put 30 seconds on the clock to let you get started. And for those who are still typing, continue to type away, put your information in so we can help you out. Okay, what we want to do now is give everybody's 30-second introductions. We'll start with people here in the room. So if you want to stand up, come up, grab the microphone, and we'll let everybody here do their 30-second introductions. Yes.
Yes. Good morning, everyone. My name is Jenny Holcomb. I'm looking for a job to organize a construction site. I'm looking at Perry Homes, to be specific. I have contacts at Duke Cannon and Army Air Force Exchange Service. And I put the sizzle in sales. My name is Jenny Holcomb.
Thank you.
Good morning. My name is Martha Montgomery, and I'm looking for a job in customer success, customer engagement, implementation. I am looking for a contact at McKesson. Certainly someone has one there for me. And I have contacts at Hologic, and my name is Martha Montgomery.
Thank you.
Good morning. My name is Sarah Hoyle. I'm a mortgage and commercial loan analyst, and I'm looking for a contact at Green Brick Partners. And again, my name is Sarah Hoyle.
Thank you.
Hello, I'm Paul Hussar. That's H-U-S-A-R. I'm a VP Director of Customer Support Indoor Technical Service. Rockbot is looking for me. If you know someone there, please help them. I can help with contacts at LG. I'm Paul Hussar.
I'm Lincoln Turner, recent graduate from Wesleyan University and current instructional designer at MSc Accounting and Bookkeeping Services. I'm looking for another job as a soft launch position in instructional design, as well as getting ready to start as a theater major, as a graduate in theater major, private lessons for preparing for auditions in the high school location area. I have contacts, like I said, at MST Accounting and Bookkeeping Services, as well as Dallas Children's Theater, and currently I'm also, as part of that,
Jeff, we lost the sound.
No audio.
TIG welding or fabrication. I need contacts at Atlantic Food Bars or other industrial manufacturing companies. And I have contacts at the Oak Point Rec Center off 6000 Jupiter Road. Again, my name is Daniel Reisinger.
Hi, I'm Christian Markham. I'm looking for security analyst positions. I am looking at City McKinney, Sam's Industrial, and trying to broaden my targets. And I have contacts at Frisco ISD and Motorola Solutions. One caveat is there have been a lot of turnover, so that's decreasingly less so because some acquisitions and stuff like that. My name is Christian Markham.
Thank you.
Morning, folks. It's Friday. This is Penn Hoyt, like right with the next N. I'm Director of Marketing. I've got contacts with a variety of companies, including telecom and high tech. Take a look at my LinkedIn and I'll go from there. Right now I need a contact at Asperia. Had a good interview with them, looking to take it longer. So again, Penn Hoyt, thank you.
Thank you.
My name is Stevie Booby. I'm a software engineer. I don't have a target company right now, but I have contact at Southwest Airline, American Airline. My name is Stevie Booby.
Thank you.
Good morning. My name is David Coward, and I am looking for a client account director position. This week I need contacts at the American Heart Association, and I have contacts at IBM and Manpower Group. Again, my name is David Coward.
Thank you.
Good morning. I'm Jonathan McHale. I am a human capital management executive. I am looking for contacts at any of the major consulting firms such as Ernst & Young, KPMG, Accenture. And I think that's it. I'm Jonathan McHale.
Thank you.
Good morning. I am Cecile Fordyce. I have a background in accounting and finance. I am a CPA. I am looking for a job as a corporate accountant, senior accountant, or accounting manager. I currently don't have a target company and I'm open to different industries. I add value to companies by revamping manual processes and turning them into more efficient process while increasing quality and accuracy. My name is Cecile Fordyce.
Good morning, Matt Keelan. I'm an IT VP or director. No target companies this week. I can help you with Grant Thornton and Cherry Beckert. Matt Keelan.
Screen. Okay, hold on. Where's the screen? Good morning, everybody. I'm Jema Ball. I'm looking for a VP Director of Operations in service delivery or product implementation. This week I need contacts at R1 RCM. I can help you with contacts in the hospitality industry. I'm Jema Ball.
Good morning. I'm Valisa Madden. I'm looking for any jobs in the area of Director of Risk and Controls, Director of Internal Audit, or Senior Manager or above. I need contacts at Baker Tilly, Capital One, any of the top consulting companies or in manufacturing. I put my information in the chat as well. I have contacts at AT&T, Grant Thornton. Again, my name is Valisa Madden.
Thank you. Anybody else in here? All right, let's go online. David Turner.
Good morning. My name is David Turner. I'm a HR systems analyst specializing in SuccessFactors Employee Central Security. I don't have any target companies this week. I do have contacts at PepsiCo. My name is David Turner.
Thank you. Andrea Rust.
Hi, good morning, everyone. I am Andrea Rust, and I am looking for a learning specialist, an implementation specialist, or a customer success manager role. I would like contacts at LCRA, which is the Lower Colorado River Authority. I'm sorry, I do not have any contacts at this time to share. Again, my name is Andrea Rust.
Thank you. Jeanette Cole.
Good morning. My name is Jeanette Cole. I'm looking for a client engagement position in marketing technology field. And my name is Jeanette Cole.
Cecil Forsythe. Cecil. All right, how about David Turner?
You already got me.
Oh, already got you. All right, thank you. Ellen Carter.
Morning. My name is Ellen Carter, and I'm a director of strategic sourcing and indirect procurement and supply chain optimization. I'm looking for opportunities in the food industry and or in general in the CPG industry. I don't have any specific requests for today, but I do have a contacts in McKesson and also PFG. Stands for Performance Food Group. So if you need contacts, reach out to me. And my name is Ellen Carter.
Thank you. Elon. Oh, hey.
Yeah, happy Friday all. My name is Ilan Ohayon. I'm an aerospace and defense executive with over 25 years of experience in the international and domestic market. I'm currently looking for an aerospace and defense company here in the area, in the DFW global area. I'm trying to grow and achieve greater efficiency to companies by transforming and modernizing their supply chain operations or leading a business segment. I have contacts at Elbit Systems. Reach out to me in my LinkedIn profile if required. I'm Ilan Ohayon.
Thank you. Jason Irish.
Good morning and happy Friday. My name is Jason Irish. I'm a financial services professional working my way through licensing to become a licensed advisor with Thrivent Financial. I have contacts with Thrivent Financial, of course, as well as Fidelity Investments, Schwab, several other financial services companies, as well as several banks. Connect with me and I'll connect you. It's Jason Irish.
Thank you. Jeanette Cole.
You got me already. Thank you.
All right, thank you. Carrie Padilla.
Hey, I'm Carrie Padilla, project manager in IT, and looking for a job in that area. Good luck, everybody.
Lori Brown.
Hi, everyone. I'm Lori Brown. I'm actually not looking for a job. I'm working part-time as an instructional designer for a leadership company in Fort Worth. I'm also my mother's caregiver. I'm here to listen to Mike. So I hope everybody has a great weekend and good luck. I know this job search is tough. Been there. Again, my name is Lori Brown. And for the gentleman that is looking for an instructional design, connect with me on LinkedIn. I think we should talk.
Thank you. Jeffrey Albert. Jeffrey. All right, Lori Brown.
You already got me.
I got you. Did I do Mark Jermansky yet?
No.
Okay,
It's
you're up.
Mark Chamansky. I'm a senior technical writer looking for remote technical writing jobs. And I have contacts at Motorola Solutions. Again, my name is Mark Chemansky.
Thank you. Lori Brown.
You got me.
Okay. I'm going to come up with a different system next week. All right, Miguel Castillo.
Good morning, everyone. My name is Miguel Castillo. I'm looking for a VP or director in finance in the financial planning and analysis space. Need contacts at San Mina and Michaels, and I have contacts at American Airlines. My name is Miguel Castillo.
Thank you. Nikki Duncan.
I'm Nikki Duncan. I am looking for operations management work remote. I don't really have any target companies, but feel free to look at my LinkedIn profile. I have a diverse network. So ping me if you need help.
Thank you. Rose Benton.
Good morning, everyone. My name is Rosina Gallman, and I am your Career Tip of the Week host. So I'll be back in a few minutes. I'm looking for a position as a senior talent acquisition partner or senior recruiter position, and I need contacts at Delta Dental, MetLife, USAA, TIAA, and T-Mobile. I have contacts at a variety of different companies, so as I hear them, I'll reach out to you directly. And again, my name is Rosina Gallman, Senior Talent Acquisition Partner or Senior Recruiter position. Thanks so much.
Thank you. Chandra Thomas.
Hi, my name is Chandra Thomas. I'm looking for an administrative analyst position. My target companies is United Health and Blue Cross Blue Shields. I don't have any contacts. I need contacts at those areas, but I'm not connected with companies. Again, my name is Chandra Thomas, based out of Garland, Texas.
Thank you. Steve Rohan.
Good morning. Good morning. My name is Steve Rowan. I'm a retired .NET developer, and I have contacts at Fiserv and the VA. My name is Steve Rowan.
Thank you. Terrence Brooks.
Good morning, everyone. I'm Terrence Brooks. I'm an IT executive who aligns technology solutions with business strategy to deliver measurable outcomes and long-term growth. I'm seeking positions as Director or VP of IT. The target companies are DuraServe and HKS. And if we're not connected on LinkedIn, please connect. I have a diverse connections in the DFW area there. Again, I'm Terrence Brooks.
Thank you. Tracy Harris.
Good morning. My name is Tracy Harris. I'm a senior recruiter at Thomas Edwards Group. We are a boutique firm focused in accounting, finance, HR, and IT recruiting. We work on both sides, so direct hire roles and contract to hire roles, and we're local to the DFW area. My name is Tracy Harris.
Thank you. T's iPhone. Mr. T, you on the phone? Maybe not. All right, let's go Yolanda Rojas.
Hello, my name is Yolanda Rojas. I'm looking for a customer service or product support position. My target companies are APHIS and McKesson. I have contacts at Texas Instruments. My name is Yolanda Rojas.
Okay, who did I miss online? I know I had to miss a couple people.
Michael Wilk.
Oh, Michael.
Happy Friday, everybody. I am Michael Wilk. I'm looking for a senior or lead quality engineer or quality manager position. My current targets are Boeing and Collins Aerospace. I have contacts at Raytheon and L3 Harris. I am Michael Wilk.
Thank you. Mike Belize.
Hello, everyone. My name is Mike Belzil. So I help business leaders make better decisions, grow their profits using data, analytics, and AI products. Looking for a senior director of product role based in DFW area. Target companies include Keurig Dr. Pepper, Toyota, and Amazon. So I have contacts at Walmart, Epsilon, and Circana. So my name is Mike Belzil.
Thank you. Rose Benton. Jeffrey.
Good morning. I'm Jeff Aubert. I'm a customer-facing technical sales engineer. I build and maintain customer relationships through pre and post sales engagements in a technical and a sales manner. I'm looking for sales engineer, technical account manager, manufacturer type roles. I need contacts at Interstate Wire, ANSYS, and Hatch. I have some contacts at Cadence Design Systems and Synopsys. My name's Jeff Aubert.
Thank you. Casey Cockrell.
Hi, I'm Casey Cockrell. I'm a senior operations and IT leader coming off a successful exit of my family's manufacturing business. I specialize in process improvement, ISO 9000 compliance, and digital transformation, especially where systems and people meet. I'm looking for my next director or VP of operations role at a mid-sized company in North Texas. And I like solving problems at the intersection of tech and operations, and I've been told that I translate geek into business speak and back again well. I'm currently targeting CBRE, PepsiCo, and Sterling Engineering, and I have contacts at a bunch of different companies, SRS, and some financial firms. Link up with me on LinkedIn, and we'll see what I can help you with.
Okay, did I miss anybody else online? All right, we will move on. Okay, job leads. Tracy, you want to talk about what's going on with your firm?
We've got a few new roles this week. It's been a little bit slower. It's funny, I was talking to my husband about this, and he thinks that everyone's kind of taking those last minute vacations before school starts again. But recently received a property accountant role, specifically targeting people coming directly out of public accounting with an active CPA. We're working on a couple CFO roles that I mentioned a couple weeks ago as well, looking for a lot of specific things, but that's kind of what we've got more recently.
All right, thank you. And Tracy's contact information will be in the chat that you can download later. Thank you very much for being with us today. All right, it's time to hear from the Interview Success Workshop. Walt Lass.
Good morning, North Dallas Plano Career Focus Group. I am Walt Glass. Good morning to you that are online as well. I'm going to show you the back of my head. It's prettier than the front. Okay, so what do? I like to help people with interviewing skills, and I do it offering a free interview success workshop. It's based on selling who we are, what we do, and how we help. I call it the I am, I do, I help model. I think I'm going to change my last name to I'm going to do a help. So it'd be, well, I'm going to do a help. All right. And so how do we do this? Well, it's free. It's online. It's on Zoom. It's on Tuesdays. Look at my LinkedIn profile. The About section is about the workshop. Tells you how to register. Has my email and phone number on the banner page. So it's easy for you to reach me and contact me. I took a couple of weeks off. That was nice. But I'm back in business. And so I wait list a few people. I only schedule out 2 or 3 weeks in advance, but I'll still be glad. I'm going to put some information into the chat window so you can reach me there, and it gives my LinkedIn, address, all that stuff in the chat window. So I'll be glad to have you register and attend. So the idea is when we are interviewing, are we responding or are we selling? Well, we're all selling, and we're selling ourselves. And I define that as the I am, I do, I help. And so I'm going to help you gain that selling mindset and go about telling you how and what we can do to sell ourselves and our answers, okay? For example, what are your strengths? They are ABC. Well, what if we said, and with these, I can help you achieve DEF. So also I am and I help in the same answer. All right, as an example like that. Okay, so be glad to have you come. It's not meant to be a mock interview. In fact, it isn't a mock interview. It is a learning interview. We're just here to learn. I don't want to put any stress on you. I don't need you to squeeze your cheeks. All we want to do is have some fun while we're learning, right? Why don't we do that? So I call it learning without squirming. Are we ready to sell who we are with our experience wide and far? And adding value when we pulling you up to the bar to get that job and be a star. I am Walt Glass.
Thank you. All right, Paul, you want to talk about the Dallas Pit Crew?
And ladies and gentlemen, may I introduce to you for your kind, loving enjoyment, pleasure, Paul Hussar.
Thank you, Walt. Please raise your hand if you're looking for an interview. Wow, so many of you. I can help. I represent the pit crew. That's the practice interview team. We meet here every Wednesday afternoon at from 1 to 3 p.m. Every fourth Wednesday, we're online. We do conduct mock interviews with a panel of 3 interviewers. These people are experienced interviewers who have done that professionally. We can give you feedback on your interview performance, and I guarantee you, no matter what role you play, interviewee, interviewer, or observer, you're going to learn a lot about how to prepare for an interview and execute the best interview that panel's going to see. Our motto, I remember our motto, it is practice early and practice often. Thank you. I'm Paul Hussar.
Thank you, Paul. All right. It's time for our career tip of the week. Good morning, Rosina.
Good morning, Jeff. Good morning, everybody. All right, give me just a second to pull this up. And this week's tip of the week is 20 ways to be more hireable. Imagine that. We're not trying enough. All right, so this article is written by Connor McMahon, and he is with Sonara. So improving your hireability is crucial for standing out in today's competitive job market. It's about positioning yourself as the ideal candidate, someone employers actively want on their team, rather than just another applicant checking off boxes. Your hireability isn't fixed. It is to be actively improved through strategic efforts in how to present yourself, network, and demonstrate your value. So in this article, it highlights there are 15 key strategies to enhance your hireability. First being search with intention. Don't just apply broadly. Define your career goals and target roles. And with those companies, you want to highlight and align with your skills, values, and aspirations. Next, you want to build a succinct, effective base resume. You want to create a strong, concise resume, 1 or 2 pages, that clearly highlights your most relevant skills, experience, and accomplishments. Next, you want to prove your impact. Quantify your achievements rather than, or whenever possible, and then instead of vague descriptions, use numbers, data to demonstrate concrete results of your contributions. Next, you want to tailor your base. Oh, sorry. The last one was tailor your base resume to every job. I forgot that little part. Next, you want to give your cover letter the attention it deserves. Your cover letter is a chance to show personality and make a strong impression. So avoid generic templates and never submit unedited AI-generated content. As many hiring managers discard those right now because there are so many of them. Next, you want to build a personal brand. Develop a strong personal brand that showcases your expertise. Next, you want to optimize your LinkedIn profile. Since LinkedIn is often the first place recruiters look to ensure that the profiles are complete, you want to make sure they are complete with a professional photo, compelling headline, and detailed summary. Next, you want to stay updated on industry trends. Demonstrate initiative by staying informed about the latest trends and advancements in your field. Next, we're going to upskill as much as possible. Continuous learning is vital and key. Take online courses, attend workshops, and pursue certifications to strengthen your expertise. Next, you want to grow your network. Networking is powerful for uncovering opportunities. And like the people there in person, you guys are going to network even further once you have lunch. So that's a great opportunity to continue to grow your network. Tap into your network for referrals. Once you have a strong network, leverage it. Referred candidates have a significant advantage in the hiring process, so don't hesitate to ask contacts for recommendations or introductions to companies that you're interested in. Next, you want to strengthen your references. Choose references carefully, prioritizing supervisors who can speak confidently about your skills, work ethic, and contributions. Next, you want to consider freelance projects. If you're struggling to land a full-time role, freelance or contract work can provide valuable experience, expand your portfolio, and develop new skills. Employers are often value the initiative shown by those who seek practical experience, but I would highlight as a recruiter, make sure you put in bullets or put in parentheses that is a freelance project or contract work or something of that nature to identify it and not let it just be out there that it's potentially a job that that may be short. So identify what that job is, contract, freelance, and such. Next, you want to master the art of interviewing. Even highly qualified candidates can falter in interviews. Prepare thoroughly by researching common questions, practicing your responses, and refining your storytelling methods, such as using the STAR method: situation, task, action, and result. Confidence and preparation make a significant impression. And then lastly, always follow up. You want professionalism and enthusiasm to be the key. And so send thank you notes or thank you emails after interviews, check on application statuses, and periodically reconnect with networking contacts. Thoughtful follow-ups keep you top of mind and reinforce your interest. Now, the most hireable skills that employers are seeking, well, the modern job market demands professionals with both technical expertise and crucial soft skills. So businesses are increasingly valuing adaptability, creativity, and leadership. Drawing on insights from various authoritative sources, there are 5 highly sought after skills. First is technological skills. Proficiency in technology is a non-negotiable. AI, especially generative AI, modeling and data annotation, that data analyst skills, cybersecurity, those are now essential as companies integrate digital solutions. Excuse me. Excuse me. Creativity skills. Creativity remains an irreplaceable soft skill, so employers seek individuals who can think creatively to develop content, design products, and solve complex problems. Adaptability skills. The adaptability to navigate rapid change is a significant career advantage, and employers want professionals who can adjust to new challenges, embrace emerging technologies, and stay ahead of industry shifts. Leadership skills. Leadership is essential across all organizational levels, not just for management. Companies need professionals who can influence, inspire, and drive results by demonstrating strong decision-making, strategic thinking, emotional intelligence, effective communication, and the ability to motivate others. And lastly, reskilling and professional development skills. Continuous learning is a non-negotiable aspect of a successful career. Employers actively seek candidates who can take the initiative to develop new skills and stay relevant. So proactive reskilling, along with the ability to mentor and coach others, makes you a highly valuable asset in any workplace. So why does it matter more than ever? Well, the current job market is characterized by rapid technological advancements, economic fluctuations, and evolving hiring practices, making strong hireability more critical than ever. Employers are looking for professionals who can adapt, contribute immediately, and grow with their teams, not just meet minimum requirements. So being highly hireable means you can demonstrate problem-solving abilities, collaborate effectively, and commit to continuous learning as industries evolve. The stronger your hireability, the more control you have over your career path, whether you're actively seeking a new role or preparing for future opportunities. So I hope you guys enjoy this article. This was just a summary of it, so you can read more details if you go back to the original article. And again, this is 20 ways to be more hireable, and this is by Sonara. Have a fantastic weekend, everybody.
Thank you, Rosina. All right, today for lunch, we're gonna go to Country Burger, hopefully around 11:45, 3115 West Parker Road. It's on the northwest corner of Parker and Independence. They've got burgers, salads, chicken sandwiches, and more. If you want this particular burger, though, you will need to bring your own ham. They do not have sliced ham to put on the hamburger. If you'd like to receive today's materials, you have a chance to get the speaker presentation, a link to the YouTube channel that this video will go to, a copy of the career tip of the week, a copy of the Zoom chat. You'll get that as long as either you've checked in online on the roster, or if you're brand new, if you filled out legibly the little slip telling me you're new, I will get you added. For those people online, just make sure that your name and email address is in the chat somewhere so that I can get that added. All right, it's time for our main event. If you have any questions throughout the presentation, just enter them in the chat window and I'll interrupt our speaker and get those questions answered for you. So today our main event is health insurance for job seekers. For those of you who don't know Mike Chapman, I guess I've known him for almost 20 years now. He's been helping job seekers for the last 20 years with alternatives to healthcare. What else can we do? What else can you do besides just being on COBRA? And he is up to date and in tune with everything that's going on. So let's introduce Mike. Let me go give him a microphone.
Yeah.
Pop up to Cynthia's cake.
Okay. Can you all hear me? Okay, because I can't hear myself, but that's all right. I'll speak louder. I like to speak loud. I like to speak. I've been doing this for more than 20 years now, believe it or not. This is my second or third career. I love what I do. You know, I was in the corporate world. I bailed out of that after 2001, not by choice, by events in life, okay? I became self-employed Mr. Mom, raised two kids, two sons who I'm very proud of. Be happy to share pictures with you. What I'm here to talk to you about, I want to get to in a second, but I want you to understand empathy. I've been in your shoes. I know how hard being a job seeker is, okay? It is tough, but it's also an opportunity to refocus on what you want to do for the rest portion of the year. For one reason or another, I got into something that I ended up really liking, totally different from what I was doing before. I'm very blessed to be doing what I am and to be presenting to you today and to be invited back by Jeff and the other networking groups here and elsewhere. And there's a ton of change. You know, when I was in the corporate world, and I go back the dark ages, pre-2001, okay? Those of you that are remember that time, it was the nuclear winter of job search. And that's when I decided to go on a different path. In my corporate world, I was there's three types of people. You know, you always have that. There's the people that when their house is on fire, they'll just sit there 3 feet away from a fire extinguisher and say, "Help, my house is on fire." Then there are people that take that fire extinguisher and try to put it out. And then there's crazy fools that run to the fire. And I was always that way in the corporate world. I was in turnarounds and mergers and acquisitions, blah, 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 in the consumer products, consumer durables field. And that is the passion that I saw in healthcare and health insurance, because it is the most crazy, screwed up, over politicized, over regulated on the state, local, and federal. It changes constantly. And let me tell you, the changes that are coming this fall are going to be the greatest since 2012, 13, after the passage of the Affordable Care Act, otherwise known as Obamacare. All right. It is going to be that crazy, even more so. And it has become, there are many good things. There are many things that, you know, probably aren't so good for your particular situation, but it does cover any and all pre-existing conditions, blah, blah, blah. I want to talk about that. I'm here to talk about change. But rather than, and after or before Obamacare actually was implemented, I spoke to over 60 networking groups and business groups and associations because, you know, it was like deer in the headlights. All right, nobody knew how, and I was blessed to have those kinds of opportunities. I've always spoken, and I have the gift of gab, I think, in speaking engagements. I'm not necessarily, I say, and when I stammer. So when I hear myself, you know, and record them, oh man, would you cut that out? My point is that I have to now, because there are so many changes, I have to be smarter with my time, because everybody that is going to be searching for health insurance during open enrollment, it may be too late if you wait until then. There are a number of roadblocks. You know, you can, in the first administration, the Republican Party tried to vote down the Affordable Care Act. It didn't pass. The second administration, one of the strategies is to get it back to the original law and to the extensions and the exceptions that were put in place at the state and federal level through the previous administration bring things back. What does that mean? It's going to mean a number of things I'm going to talk about, but if you wait till open enrollment, it's going to be too late. As a result of that, I'm going to be spending the next 2 months, rather than speak, I'm going to have limited speak. And this is a moving target. The rules have not all been announced, okay? The passage or the interpretation of the regulations haven't all been finalized, but I can tell you what it is as of today, July 25th, 2025. It's going to change August 25th and September, all the way up through open enrollment and into 26 and into 27. I don't, you know, I'm going to mention that 26 and 27 briefly, but I want you to focus and get your attention because it's about to change. As a result of that, I'm going to be spending time with appointments. I have brochures that I'm going to ask some of the key advisors here to look at that can be printed up, that you can pass out to your friends, colleagues, neighbors. You know, I don't care, to warn them about this stuff. And then there's another one that that I've developed that'll help people save money on prescriptions, which, you know, prescriptions are out of cost. Prescription cost is out of control. So do I have your attention? All right. Now, it's great to see online and in this audience, current and former clients. You know, it means a lot to me that first, that you showed up, first of all, that we have a relationship. And I'm, you know, I know that I do my best, but now I have to help a lot of people
And at my advanced age, this is what excites me, this challenge for 25, the balance of 25 and 26 and 27, and God willing, till I'm 100. You know, I have no plans on retiring, and the Lord has blessed me to get through some health challenges, and now I'm ready to go. I've lost 60 pounds in the last 15 months, and I've kept them off for a year. So, man, I'm rocking and rolling. All right. And so now I'm going to bore you to death with some PowerPoints. Yeah. All right. There, everybody just turned off their Zoom, right? No. Let me get into this here and go to PowerPoint. You can tell me if you see this. Do you see? Yeah. All right. Oh crap! I hate it when this happens.
You hit share.
Where?
Go back to Zoom.
Zoom. All right.
And you want to go share.
Oh, okay. Thanks, Jeff. There we go.
Yep. Yeah, shared.
All right. Now, hopefully you can see it.
Yep. And then if you want to start it.
Yeah, slideshow.
Yeah, start from the beginning. Yep.
Cool. All right. Any problems seeing this? Any funny pop-ups or windows or something like that? I can minimize this if need be. And, you know, the title for, we've arranged for this months ago, and I've been building up to this and learning all, you know, every week there's another shoe that drops. But, you know, this is up to date as of today. It'll change. I encourage you to stay connected because and the LinkedIn info, my LinkedIn info is at the end. But anyways, let me get going here. First of all, who's heard of the Jordan rule? What's the, well, let me paraphrase it just to say for the purpose of the Jordan rule. He was at one time asked, why don't you pick a political leaning, and I'm paraphrasing, okay? Why don't you pick a political leaning or a social cause? And the smart guy, a billionaire, owns ungodly amount of Nike stock, right? Help put Nike on the map. His answer was, well, you sell more shoes if you can sell both sides. Now, here it's not about it. It is. I mean, it keeps me, you know, it keeps a roof over my head, but it's not about selling. It's about helping. It really is. That's, you know, I don't need to be doing this stuff. I want to do this. I want to bring this to you and not curate. That sounds silly, but make it as concise as I can. So forget the political stuff in this. I am a licensed broker in 18 states, and I've been awarded since it came into inception about a dozen years ago, the Circle of Champions, which is for the top whatever percentage of health insurance brokers in the U.S. With no experience. All right, Mike, I was like you guys. I was in the corporate world, a salary slave, blah, blah, blah. But I became a healthcare subject matter. And like I said, I got out of this at age 70 or at age 50. Oh, I just gave away my secret. Here's my value proposition. I'm going to help you get hired faster if you take this advice. It'll reduce your cash burn. Every month that you're sitting in a seat like this, or in South Lake, or at the Frisco Connect, is a month without benefits and pay. That costs big bucks. And clients, I'm here to support, and you know, the community, I'm here to support you for your life and my life and beyond. And I'm going to answer questions that you don't know to ask. You don't know this stuff. You don't want to waste your time on this stuff. There's no additional cost to work with me. Okay. Yeah, you can learn this stuff on your own, but you know, bring it to you in a way, and I'll meet with you, but I have to be smarter with my time. Interesting times, the Chinese curse. There's before COVID and there's after COVID. We are now living in a different world with all this AI stuff that us guys are trying to learn, and tons. If you haven't noticed, there's been a lot of political upheaval. What? Strange. And I'm not going to bore you to death about demographics, but there's also did you know that there are in supply chains, tariffs and things are impacting cost of meds, the cost of all the different tubing and everything for IVs, it's going up and there's shortages and it's leading to costs. And of course, we already mentioned politics. Healthcare costs have tripled over the past 20 years. And I've been in this business. And there's nothing that I see that is going to change that other than working on your own health. That's how and the scary thing is about 25% of all children are now pre-diabetic, and you get to be in your 60s, it's over 60%. So, think about the health impact, and that's just diabetes. That's not all the other associated things. Now, when you're in a job search, you are in sales, as everybody has said here. So the more that you focus on what's important, the most important concept for anybody that is a career salesperson is return on time invested. Don't waste your time on stuff that isn't going to get you to your goal. Be certain that you are making the most of your time. Now, change is neither good nor bad. It's inevitable, but also drives opportunity. And by your focusing on this stuff now, you're going to be so much farther ahead than your associate. And people that you tell about this recording and the brochures and forward the info on, they're going to be so much further ahead than people that are trying to fumble with this stuff in November and December. Now, we're in the doldrums, right? Preschool vacations. It's a slower period of the job search. November and December will be different. Imagine having to focus on this stuff during open enrollment when, in fact, 90% of the support personnel have been cut from healthcare.gov and third-party navigators and assisters. You'd think that there was long waits on hold during the first year of the Affordable Care Act when healthcare.gov just, was down more than it was up. It's going to be just like that and then some this fall. So do yourself a favor. If you have things that are going to, and this applies not only to people that are newly released from a company, people that also applies to people that have a plan now. There are a number of things that will slow you down. Now, I've got a new value proposition. That is, I'm going to help people navigate to healthcare and insurance in this stuff. And this is really key. There are changes I mentioned that I found out about a change that was put in place that hadn't been announced on my birthday, June 5th. I had enrolled somebody, a client who had a spouse who was not born here. She was legally present. She had a green card. It took until this week after he applied to actually complete his application. And that is in the slow period. Imagine what this kind of stuff would be like in November, December. So do yourself a favor. All the things that you're going to learn here, I can help you with. We've got to be smart about your time and my time, but I can help you with this stuff so you're not tripped up on this stuff. Because next year, there aren't going to be any do-overs. You're going to have 60 days from loss of coverage. And there's not going to be extensions beyond the open enrollment period. So, there are all kinds of ways have been for the last 10 years to avoid that, to be able to get coverage pretty much any time of the year if you were recently unemployed because your income is low. So you would qualify for a qualifying event, no more. All right, so I'm going to go through this stuff. I've got a new value proposition that's pre-check now for open enrollment and special election periods. And this starts, a lot of this stuff, I'm going to be prepared August 1st. I'm redoing everything, website, workflow automation, whatever the heck that is. I've got people doing all this stuff, but basically, people will be able to call, they'll be transferred. You'll get an email where you can enter your information. And then I'll have what I need to be able to make recommendations, and we'll set an appointment to go through that checklist. I won't be able to just take as much information over the phone because I'm going to be a busy man for, from now until January, the end of January. Let's review before I get into the nitty gritty of the details of the changes, let me talk about overview for those of you that are new, and I'll go through this class. First of all, apples and oranges, an individual health plan. There are no such things as PPO plans in Texas and in most states. The only states that have it are rural states that, that don't have a lot of people in the population. It's very spread out, and they have a PPO and they pay more for it, but not in, I would say, most states. What that means is there is no out-of-network coverage other than emergency hospitalization. There are going to be higher out-of-pocket maximums and higher deductibles than you are used to in most employer plans, unless your income estimate, and I'll get into this, unless your income estimate is low. How much you pay for insurance for you and your family is based on your date of birth, taxable, gross income, not net income, for the calendar year, your home zip code in your county. And this is a year-to-year purchase because, the rules are changing like every couple of weeks. All right. The enforcement of the rules are changing. And this applies to people that are under 65. There's, because these are HMO plans, you're going to have to get a referral from a primary care physician to see a specialist. So knowing which doctors are in which hospitals are in which plans network is really key. You can't just compare how much you're paying. That's the wrong, it's like, what do you need? The last thing you want to do is pick a plan that the closest PCP is a nurse practitioner in Arlington if you live in Plano. And some carriers are like that. Okay, so it's more than just going for price. Your adjusted gross pre-tax household income. Am I boring you to death with all these terms? Go back and watch the recording and put it on slow, and then you'll fall asleep. This stuff, I guarantee you listen to this at 10 o'clock. If you're an insomniac like me, it will put you to sleep. So you base it on what your estimate is for this year. If you end up making more, great. You may have to pay some of that premium tax credit back. But what's happened? It's helped cash flow, right? It's helped cash burn. All right. Just don't forget that you have a tax liability next April. Now, this is this year's federal poverty guidelines. All right. And 2026's federal poverty guidelines won't be announced until, I don't know, sometime in October, usually. I want to go through this, and in Texas, because Texas did not expand Medicaid, and most of you live in Texas, there may be some remote online that are in other states that I can probably help with too. I represent carriers in other states, and I'm certified specifically in the Georgia State Exchange. If in Texas, your income is less than 100% of the federal poverty level, and this is based on household size, the people that are on your tax returns, you may have a child living at home, God help you. But if you don't put them on your tax return, they don't count. They need to get their own plan. Let's say a couple. If your household income estimate because of job loss is less than $20,440, you can get covered, but you don't get a premium tax credit. Well, in that case, the premiums are going to be really super expensive, all right? A premium tax credit, not and you would also qualify for what's called cost sharing, another acronym that means your out-of-pocket expenses are subsidized. The original healthcare.gov Affordable Care Act, after 400%, and this is a sliding scale. So the less subsidy you get if your income is 400% federal poverty level. Well, that was extended in the previous administration under the Inflation Reduction Act, which is an oxymoron in itself. It extended this far beyond 400%. So if you have a plan now, guess what? It's being moved back to the original for open enrollment. Also, if you have children under the age of 19 in Texas, and your income is less than 150% of the federal poverty level, then your family application their portion would actually go to Texas CHIP or Texas Medicaid, which will cover them. Great program, awesome network of doctors and hospitals, may not be their particular doctors. However, because of the backup of people that have lost coverage under Medicaid, it's taken 90 to 120 days to get approved. So if Johnny or Susie needs to get a physical for fall for athletics or something like that, you're going to have to pay for that out of pocket or get it through the school, because it's not going to, it's not going to happen in time. 150% or less also is the cutoff for what's called the cost sharing. That if you select a silver plan, it reduces your out-of-pocket medical expenses, your co-pays, deductibles, blah, blah, blah. All right, so 150 to 100%, and then it's a sliding scale according to your income. Beyond 150%, no premium tax credit. Some of you may be custodial grandparents, or you may have adopted children. Their application will automatically go to CHIP or Medicaid, all right, until they're 19. And again, it's a great program. Just want you to know the rules. I've already covered this. And in other states, besides Texas, I don't want to focus on, in other states, they may have expanded Medicaid. So working adult may be eligible for Medicaid in that particular state, but the federal funding for those states that don't have work requirements in place in 2026 will be cut. It's not going to have an impact big time until 27, but it'll start being implemented in 26. Now, let's say you don't have income. Let's say you have an extended job search, okay, and you can't come up with what you need to hit that minimum income to qualify for premium tax credit and cost sharing. This is a strategy. You're not going to hear this if you go contact Blue Cross Blue Shield or go online or pick up the phone and call a call center, and God help you if you do, because you'll get more calls than you've ever thought possible for 90 days, no call rules. You can, if you have money in a 401k or IRA, you can convert pre-tax money into after-tax money, or maybe you're doing that anyway. That counts as income, so, but you don't have to do it now. You can do that in November, convert or move it to a checking account, because the value of that premium tax credit and the cost sharing is huge. I mean, it's so much more than the if your income is low, what's your tax rate? Maybe 10, 12% federal tax rate. It's low, but the value of the premium tax credit can exceed it can exceed $10,000 for a couple. Also, if I forgot one thing, if you're pregnant, God help you. We need more children in this world. It's a good thing, but your coverage will be Texas Medicaid if you're pregnant when you apply. And also resident age alien. The other thing is that I have got many clients that move their parents from another country to live with them in old age. They would qualify for Affordable Care Act if they're legally present, green card, but you have to make sure that all the stuff is worked out now, because nobody's going to be there to help you during open enrollment, and you may miss out. Now, if you don't qualify for premium tax credit and you have you can still elect COBRA in the first 60 days since coverage ends, you may find that COBRA is comparable, possibly less money, but it's liable to be a PPO plan with a lower deductible, better coverage for the same money. Also, if you've had medical expenses, or one person in your family has had medical expenses, and you've met or come close to meeting that deductible, you can split off that person, maintain that person on COBRA, and the rest of the family apply for an individual plan, okay? Best thing to do, again, it's not dollars and cents. Think about medical out-of-pocket medical expenses and how to maintain doctor-patient relationships. And that's what I refer to as unbundling. You don't have to have everybody on the same health plan. Maybe somebody is eligible for Medicare, maybe somebody has medical expenses this year, or has a serious health condition, needs to maintain relationships with specialists that aren't in any of the networks through the Affordable Care Act, then by all means, that person should be on COBRA for the balance of the year, maybe beyond if COBRA stretches. And if you have children who are college students that you're paying for, God bless you. I know it's painful. I know the FAFSA form very well. The university plan may well be the best coverage at the lowest cost for that particular person, and out-of-state family members, or even a child who's going to college in another state. If there isn't a student health plan, then that person needs to be on a separate plan for that particular state, because what good is a Texas plan going to do if there's no providers out of the state? Now let's talk. So everybody, I'll answer questions at the back. Now that's the preamble. Let me get into the changes. Have I bored you to death or put you to sleep with PowerPoint yet? Where's that cowbell? All right. I'm going to go through this. And this has happened. This is just snuck up. Resume special enrollment period, pre-enrollment verification. This is one thing that every job search orientation group needs to put in their orientation meeting. Hang on to that termination letter or that notice, because you are now going to have to, and you go through the application, but then you'll have to provide that notice before you can qualify for a special election period from having been terminated. And like a lot of stuff, I've been there, you're in shock, you're numb. You kick the dog, you let your wife beat you if you're married, it hurts, but so does not having coverage. So you don't want to be wasting time, again, return on time invested, looking for that termination letter, because you're going to have to upload it to healthcare.gov, which I can help you with. You have a termination letter. There's some other things. There's a maximum. As I mentioned, I enrolled somebody on June 5th. It was July 20th. And this was a different situation. This was a spouse who had a green card, but it took that long for it to get approved and processed during the slow months. All right. And 10 to 14 days, that's out of date. It's going to take longer. Now, right now, this is part of the oxymoron known as the Inflation Reduction Act. There was a special election period put in place that anybody whose income estimate is less than 150% of the federal poverty level had a special election period anytime during the year. It's gone. So you've got 60 days and then you've got COBRA, but you better make up your mind in that 60 days because there's not going to be any do-overs next year. Got it? And this is actually in place. This is not in place now, but it's going to be. Now, this is another acronym, DMI. Data matching issues. And there's a whole long list of them, all right? Income estimates, citizenship, 1095A forms that you get from the insurance company, and 8962 is where you reconcile that 1095A between what you estimated and what you actually report as income for the year. If you don't have that reconciled, you will not be able to enroll in insurance come open enrollment period. Sorry, guess what? You've got time now that you know this to get it done. Income, if you haven't paid taxes, if if you're delayed or if you've extended income tax, you're not going to be able to get covered through the Affordable Care Act. Now, the rationale for that is that, okay, we're going to give you $10,000 or more in premium tax credits, and you haven't paid us income taxes. What's wrong here? So that's the logic behind that. If some information, yes. You won't know until you go through the application. That is the crux. So, well, all of these things I can help you get, I've got a long checklist, and this is just the beginning of it. There's a whole list. If you Google data matching issues, you'll come up with a list of some of them on healthcare.gov, but there's more. So this applies not only to new people applying, but to the tens of millions of people that have applied through healthcare.gov or state-based exchanges. And there's not going to be any extensions, and nobody's going to be helping you. All right. There's not going to be navigators, assisters. The phone lines at healthcare.gov, I can just imagine, and all the state-based exchanges. Excuse me, pardon me a second. So do you understand? I'm not excited. Get them all clear. Yeah. Correct. Just what Matt just said is that you want to make sure that any of these things are cleared up now. It may take for instance, maybe your income was low enough last year that you didn't think you needed to file for income taxes in April. Wrong. So, the IRS is going to say, oh, you didn't file taxes. Well, guess what? You're not going to be able to get covered. So there's a lot of gotchas here when you think about this, and there's more stuff coming. Executive actions are like, daily. So the answer is he who hesitates or she who hesitates is lost. You got it? Don't wait. So, I'm motivated to help as many people as I can. I'm not excited about all these changes, but they are what they are. Income estimates. They may not accept, if you were making 250K and then you show no income, well, guess what? They're probably going to say that's a data matching issue, even though it's right. But you're going to have to submit documents that will be processed, and now's the time to do that, because come November 1st, first day of open enrollment, nobody's going to be there to hold your hand. Got it? Marketplace integrity, and affordability. Now, there is what's known as a zero premium plan. Many people, who are on a silver or bronze plan, the premium tax credit, when it's deducted from the normal premium without the premium tax credit, they end up with a zero premium plan. Well, in past years, you didn't have to re-enroll. Okay, that's not so. For during open enrollment, in that case, it's called a passive enrollment. They just, Blue Cross, United Healthcare, whatever, they just roll you over in the same plan. Even though the plan changes, they'll move you to the most appropriate plan. Can't do that anymore. You'll have to re-enroll, and if you don't, you're going to pay $5, a minimum of $5 in premiums. Okay, but most people have not put any checking account information or credit card information on their plan. Well, they're going to be bounced out. Okay, so that's another issue. And here's the dates. This year, open enrollment is January 1st. I'm sorry, November 1st through January 15th. If you want coverage by January 1st, you have to enroll by December 15th. If you enroll from December 16th through January 15th, then coverage begins February 1st. Now, who knows here's another acronym for you, FTR. No, it's not Federal Terry Roosevelt. It's another, and this goes into effect January 1st. You're subsidy ineligible if you have not paid your taxes or filed taxes. All right. And you're going to be disqualified for life, or until the next administration gets in there, or until Congress changes it. Now let's go out further. In a year from now, again, you don't care too much, it's a here and now, but the open enrollment period will be cut in half. All right, so there won't be anything beyond December 15th. Oh, sorry about that. Hold on 1 second. So significant changes. The premium tax credits, as I mentioned, are being scaled back to the original healthcare.gov law. And it's probably not going to be, it's unlikely that under the current majority that's going to change. So subsidies are going to end at 400%. So, for most people, it's going to mean an increase. Now, another key thing, you've gotten a job offer, you've negotiated, you accepted, you're ready to start, and your coverage begins 60 days, up to 60 days later. But you forgot to cancel your health insurance plan under the Affordable Care Act or state-based exchange, healthcare.gov. You're going to not be able to enroll in the future. Okay, unless you pay the premium for the months for that time period until you're booted off. But you're going to get, so some people just, I'll just not worry. I'll take my payment information out of the Blue Cross website, to use an example. That doesn't do it. You've got to call healthcare.gov and cancel your plan. Otherwise, there is a liability, dollar liability, that you have to be accountable for. So take care of that. Further out, I mentioned that next year, as it stands now, nobody knows how or when because nothing's been finalized, but there will be work requirements that will most likely go into effect in 2027 for working adults. Won't impact people in Texas very much as it does in other states. Federal funding cuts for state and Medicaid and CHIP is going to have a huge impact on rural hospital programs and systems, right? Because those depend on Medicaid. If you're thinking about where to live, I would suggest you don't want to live in hill country or rural areas because of this. We're blessed to have one of the best healthcare systems in the country here, believe it or not. You know, you might say Massachusetts is better, but they've got all kinds of crazy rules. So let's focus on the here and now and being in job search mode. This is going to derail your job search and every one of your friends and relatives and neighbors and accountability partners during open enrollment. It's not going to only impact you now, it could potentially impact you for the rest of your life. So take care of the stuff now. Get cleared. Healthcare.gov is your only option, or state-based exchange is your only option to cover any and all pre-existing conditions and get a subsidy. You'll pay more for any other option. And the short-term plan options are only for 3 months. They exclude and deny pre-existing conditions. There are Christian healthcare sharing ministry programs for those people that have either no premium tax credit or maybe they don't qualify now because of some of these things. But it all depends. My job is to help present you with make the best decision in the least amount of time. If you feel confident that you can kick it around with your spouse or partner and be able to make the best decision for you for the time being, for the year, and not make mistakes that are going to cost you down the road. And as you can see, it's changed a lot. And it's going to change next year and beyond. You know, every time there's a change in Congress, it's going to change. So again, no help, 90% funding cuts, 60 days to clear up any and all issues and exceptions during open enrollment. These apply to everybody on a plan through healthcare.gov, whether it's new, whether you're new to it or on an existing plan. And there's more stuff to come. Now, as I mentioned, I'm updating everything. Website, my approach. I'll have a newsletter. I strongly urge you to connect with. Not today. You're going to see a very ugly, non-functional website, but it will be very efficient with your time and my time and HIPAA compliant. You know, rather than sending stuff by emails or over the phone, you'll be able to fill out the information, get everything that you need, book an appointment, and then we can have a discussion and we talk about the issues, okay? I also have a new website that will, I'll talk about in a second. It's a pre-check. You know, like, has anybody had the fun, and I do because I've got 2 sons living in Colorado and a 94-year-old mother in Florida, who I visit a couple of times a year, usually over the holidays. Have you ever tried to get through an airport during the madhouse called Thanksgiving or Christmas week? Have you tried doing that without TSA pre? TSA pre clear, I don't know if it's worth the extra money just to have your picture taken, but TSA pre, you know, the lines are still long, right? Well, this is going to help people, you know, this is the main website, the medicalinsuranceexchange.com goes live August 1st. It'll cover all these things. I'm one of the top brokers in Texas and other states for Medicare. I don't publicize it, but I also help primarily clients with life insurance. The new website is aca-pre.com. It goes live. It will cover all these changes. It'll, again, you know, it'll have a QR code that you can, if you like using QR codes, but it will basically, you get an email, fill out this form. It's all HIPAA, SOC, whatever compliant. So you'll be able to safely and confidently provide all the information I need, and then I can go to work. And actually, I'm actually mentoring a woman right now who's married to one of my best friends who is bilingual. So I'll be offering bilingual support as well here during open enrollment, Spanish. Now, you can book your appointments for clearing this stuff August 1st. Don't wait until open enrollment. You got it. So, the title, when I asked for this, I had no idea that this would be this kind of perfect storm, not a good storm, all right, but all this stuff was coming back in April, okay? But yeah, it's happening. This is important. So we all have to take action differently. It's going to cover all the changes with, whoops, pardon me. What am I doing here? This meeting is being recorded? Jeff, why did that happen? Oh, there we go. I didn't know that. So, it's going live August. If you call, it's going to go to voicemail, and you will automatically get a text explaining this, and to please fill out the form. I'll be answering not ad hoc phone calls, and I love talking to people. It's my main social output. I talk to hundreds of people a day during open enrollment and hundreds of people a week the rest of the time. It's my social life. It's pretty sad, really. But I got to be different because this is one of those times when I want to run to the fire. So the alternatives, MediShare, short-term health plan, they will exclude and deny coverage. Employer health plans and COBRA for those people in the family, or if your income is too high in Medicare. I can help people, your parents, your uncles, your neighbors, your friends. They don't know about this stuff. They're going to expect to see something like the advertisements that were jingling for the last couple of years, not last year, the year before. You can sign up for a plan for as low as $10. Constant radio ads. Well, those days are gone. It's now, and it's about to change. Our world is being rocked. Like it or not, this is the truth. Now, another stat. So that's the end of the soap opera. Okay, soapbox. Another strategy when you're negotiating a job offer. In addition to remembering to cancel your plan, your Affordable Care Act plan. If you're in sales or marketing, purchasing, many functions, they expect you to have a little gumption in terms of sales, negotiating. If a company has a benefits waiting period, negotiate for the company to pay your COBRA or your ACA premium until covered, but gross it up because this is taxable income. So you pay taxes on that money. But hey, it's something, if a company has specific pay grades and blah, 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 most hiring managers, even if they find out through HR that they can't do that, at least they appreciate the fact that you tried. What else? If you're traveling elsewhere outside of your network area, there's no coverage or any plan in Texas or whatever state you're in. So you may want to consider supplemental coverage. And if you travel on a cruise or outside the United States, I help clients with international health insurance. I have clients living in Europe and Mexico and South America who are expats, in addition to vacationers who rely on me for coverage because there's very little coverage. Even with Medicare Advantages, there's a limited amount of coverage, but they're not going to let you out of the hospital or out of the country unless you're able to pay that bill, which may be beyond your credit card limits. Okay, how to save on meds. I've got a new flyer that is will be up to date through the end of the year. It will have the top 100 medications that are prescribed in the US and how to purchase them for less money through a Canadian pharmacy. Many medications are less expensive. Many of the top medications are patented, and until those patents go up, or for instance, in GLPs, weight loss medications, well, there was a shortage, compounding pharmacies were allowed to compound the generic alternatives. Not so anymore. Many of these medications can be purchased for less money in other countries. Also, there's a Boolean search, and I'm not going to put a lot of time on this, but put in quotation marks the name of the medication and then the words prescription assistance program, because while you are income low, you may well qualify for that manufacturer's prescription assistance program. And guess what? Those robber barons known as pharmacies and PBMs and the people that make the drugs, they're paying for, they're jacking this is your chance. Don't be too proud to take advantage of this stuff. They can save a lot of money. And also, who is a cheapskate? Who is married to a cheapskate? Who is both? On this stuff, never let an adult kid make their own health decisions, nor trust a call center, healthcare.gov. They are on their screen, they're going to slam you into the lowest cost plan. Could be the worst thing for you. But also, if you're trying to compare apples and oranges, and you're going strictly on the lowest cost, and especially, sorry, engineers and accountants and left brain people, I'm talking to you. You're missing out. You're going to make a mistake. And also, don't be too proud to ask. You don't know what you don't know. I'm going to answer the questions you don't have. And do what you do best. Don't waste your time on this crazy stuff. I'm staying out up front for it. I am running to the fire, and I'm here to serve. And now, 90% of the people I talk to, they have no clue about this stuff. This is the first time I've presented this about what's about to occur. And, very few people are the geeks that really follow this stuff. But if 99.9% of the people wait until open enrollment and then find this stuff out, heaven help them. All right, so that's the end of that. Now, one last slide. Who's heard of the Big Beautiful Bill Act, ABBA? Some things, those of you that are on Social Security, you may have $6,000 coming. Estate and gift tax exemptions are raised. Medicare and Medicaid recipients. Now, I want to spend a second on Medicaid because from COVID through up until the beginning of last year, there was no checking. Anybody that applied for Medicaid, they didn't kick people off. So, states and federal government, they were, they didn't want to kick people off, especially in certain states, which I won't mention. Last year, so sorry, you've got to requalify. You have to provide documents, like any other piece of junk mail you get. Most people pitched it, or they didn't pay attention to it, and their Medicaid lapsed, and then what happened, or their chip for their children elapsed. And the first time they found out about it was when they're in the urgent care, the hospital. Right? So that was scaled back. Last year, you would read fake news that, millions and tens of millions of people would lose Medicaid. Well, it was scaled to what it was supposed to be. At least that's the theory. Now, and as a result, the people that work in the CHIP and the Medicaid offices in the different states, they're so overworked and burnt out, and they're having to they're still dealing with stuff from last year. And then there's more people that have to, will have to do the same thing in 2026, late 2026, 2027. Medicaid funding may be cut back and work requirements put in. Again, don't worry about that now. Your job is to get a job so you don't have to worry about this stuff. But don't forget this stuff, and don't forget to drop your plan through healthcare.gov. And that's the end of my presentation. I've got my LinkedIn. I've got over 20,000 LinkedIn connections. So and that doesn't mean diddly. But if I have a personal connection, we connect, feel free to look through them. I'll be happy if I have a personal relationship to introduce you, but there may be somebody in your target companies that I can help.
A couple of things, Mike. I know this isn't on the healthcare, but you mentioned the $6,000 Social Security. Doesn't that have income restrictions?
It does. If
you make so much, you're not eligible for the.
Yeah, that's right.
Yeah, they don't advertise that.
No, it's like $10 health plans. They don't give you the details.
There's another thing that I bring up. Some years ago, as I left my job and I took COBRA, I found out that if you were eligible for Social Security, they did not have to pay anything more than what Social Security would pay, or your Medicare for Medicare. So, I was paying like $800 for me and $800 for my wife to carry COBRA, but they only paid what Medicare would pay. So I was getting $5 reimbursements instead of $200 reimbursement, things like that.
This is reimbursing the COBRA premiums?
Yeah, what they told me was they said if you'd have asked, we'd have told you. But I don't know if that's still going on right now, not what COBRA does for those people who are eligible for Medicare and are taking COBRA. They don't have, it may still be the rule that they don't have to pay any more than Medicare would take. And you're paying extremely exorbitant premiums for the same, and Medicare is much cheaper. So
yeah, Medicare is a great deal right now. It'll change in the future, but COBRA and employer plans, it's based on the plan document. So it's going to vary by company.
Right.
So now questions, either from the audience here first, since you guys bothered to show up, and gals.
Less of a question, more of a plug. Like Jeff, I've known Mike for longer than I would care to admit. I'm also a client, past and current, and he has saved me a buttload of money, especially this year since my job search has dragged on. I was on COBRA last year. I'm now on Obamacare, and I have a zero deductible all this year. So reach out to Mike early and often, my advice.
Thank you.
And he didn't pay me.
Hey, my question for you. Both my wife and I are now 60. I'm 66. She will be 66 soon. She works for Plano Independent School District and is in open enrollment starting next week, I believe.
Yep.
On that, how do you compare what she has through PISD to what is on Medicare? What's the best way of taking a look at that? Because their premiums have gone up significantly this year. So the raise that PISD gave everybody basically just is going to go pay for the premiums on their stuff. So now she's like, okay, should I just drop and go to Medicare? Should I stay? Because she just has it for her. If I was added to her premium, it would double. which is why I'm
That's
not
right.
on
Yeah,
hers.
yeah. Most
So,
school districts only pay for a big chunk of the
right,
employees.
right. So it basically would eat up half her
Mm.
salaries, which is why I've been rolling the dice for the past year and knocking on wood and, carrying lucky pennies and everything around with me. That changed last month when I put a treble hook through my hand.
Ooh.
So yeah, I just got the bill from the emergency room.
Did
I
you
was
go
like,
all the way
really?
through, or did you try to yank it out?
It was hooked on something in my hand, so they had to do some things with it. So yeah, the ER bill was nice to get last month. So, but anyway, so how does one legitimately do that? Because like that basically comes down to almost apples and oranges at times to take a look
Well,
at. What's the best way to do that?
I've got shoot me an email. There is a tax for a couple. It's about $230,000, I think. If your household adjusted gross income after any deductions from 401ks or IRAs, your adjusted gross income for the last 2 years, the average of that, it's a rolling average. If it's less than $230,000 per couple, about 125, 130 for an individual, then you're not subject to that tax. It's a Robin Hood tax. People pay more for Part B as in boy and Part D as in drugs. And it can be as much as an additional $500 for Part B and $100 for Part D. So it depends on your income that the IRS has for the last 2 years. And it's a rolling average. If you're not eligible or if you're not going to be stung by IRMA, IRMAA, that Robin Hood tax, then chances are you're going to be much better off with Medicare A and B. You probably have a Medicare Part A or enrolled when you turn 65. So you have a Medicare card with Part A only on it. You enroll for Part B. There's special forms that you have to complete and submit to your employer that says you have been continuously covered by a plan that is equal to or better than Medicare. That's CMS L564. Then you have to get that form dated and signed by your former employer. And, if your spouse was on that, then that person would also need their own special form. And then you submit that and it's Form 40B application for Part B as in boy to the local Social Security office. And then you receive a new Medicare card with Part A and Part B on it. And then at that point, you can enroll in supplemental coverage, either Medicare supplement plan and a Part D drug plan or Medicare Advantage plan. There's benefits to either one of those that I can explain, but the important thing is that if you want to put this in place, you want to get that all going so that you can get the form back. And this time of year, it's hard to get a hold of anybody in a school district because they're all in meetings and blah, kumbaya stuff. Sorry, teachers. They're doing the preschool. They're kind of getting conditioned to putting up with the kids again and maybe getting that last week of vacation in. But you have to get that form signed and dated by the former employer and apply for Medicaid's a great program. Part B is in boy, $185 plus whatever IRMA will attach to it. But Medicare Part B and forget the IRMA for a second. Medicare Part B, Medicare supplement, a Part D plan will probably run about $325, and it will let you see any doctor in the country that accepts Medicare, and their only out-of-pocket medical expense is $257 this calendar year. It's hard to beat. Medicare Advantage plans, they limit the doctors you can see. They require, in most cases, referrals from a primary care physicians, lower premiums, but much higher out-of-pocket expenses. And that's my 2-minute elevator speech on Medicare, but feel free to reach out to me.
Thank you. I definitely will.
Yes.
So I also know Mike,
How you doing?
current client. He's helped a lot. So navigate pretty complex questions about this. He's also very responsive, so it's another good thing. One of the things I wanted to clear up, because I heard it and then I had to look it up while you're talking. There was a statement, which is that after 150% of FPL, your premium tax credits are go away, but it doesn't, right? It's all the way up to 400%.
It's right now the premium tax credits extend beyond 400%. They'll be scaled back to 400% next year. But what's known as cost sharing, which is a subsidy of your out-of-pocket expenses, if you select a silver plan, that is 0 to 150% of the federal poverty level. And that, you know, if you're in that range, you definitely want to have a silver plan. If, you know, if it's, and that's usually, I mean, right now through the end of the year, this is when you want, if you need hip surgery, knee replacement, shoulder surgery, you won't find a better deal. I mean, talk to your orthopedic surgeon. Now's the time, because that stuff can be attended to now real inexpensively. Next year, it'll cost more.
For those of you who do have teachers in your family, this is, without getting into my details, this is a really unique time because open enrollments are kicking up. And
Exactly.
a little trick or something I just learned that's important is that if he or she, depending on who part of your family it is, if they can enroll individually and hit a 9%, and I think you can quote it's a 9% of a federal poverty level, they have to do it. And they cannot go on your ACA plan. So that's something because it's happening right now. My wife's open enrollment is happening now, and we have to think about that. So
yeah, once there is if your income is, household income is less than that, then you can still get the premium tax credit. I mean, your wife could sign up for a plan, but without a premium tax credit, it'd be more expensive than a school plan as an employee.
yeah, because she can get a plan that's affordable, the government does not want her on the ACA plan. That's the gist of it.
Yeah.
Right.
Yeah.
That's right.
Yes.
Thank you for your time and
My
presentation
pleasure,
today.
Tammy.
Very informational. What is the number of the federal poverty level? What is that? $15,000? Is that what I saw
Let me
from your
go
chart?
Let me go back to that because that's a key figure. And the new one for open enrollment,
Yeah.
you know, we just have to wait for that to be
Okay.
issued. Let me find the right slide here. Am I still live? I guess I'm still screen sharing.
Mm-hmm.
All right. So hold
I
on.
know it was initially at the beginning, but I couldn't read that
Yeah. Until you,
little.
I had to go through, you understand, I had to go through all the current stuff
Sure.
before explaining the
Sure.
old stuff. So
Yeah, that one.
let's see if I can make that bigger without the.
And then my second recommendation would be for your presentation, because to me, there was a lot of like shock and awe. Provide either caffeinated beverages or pictures or pictures of puppies intermittently in your presentation. And just remind us that this is what we're working for. And this is very important for us to know.
Yeah, and this is the kind of stuff you're going to have the recording, the transcript. So slow it down, half speed, or stop it. But I don't want to. I didn't want to have to get the cowbell out here, especially for the remote people. Now, are there any questions from the remotes? They're all sleeping. I've been wanting to do.
I promise I'm not sleeping.
Who's this?
This is Jeanette Cole.
Hi, Jeanette.
I've been unemployed since early August. I did not elect COBRA. I have a 16-year-old who falls into the situation you were just mentioning, where now they need to go back to school, they need some shots, they need some they just need to get the form signed so they can participate in activities. So I'm not sure. what my next step should be. Do they offer just insurance for a minor?
The best option would be, well, first of all, have you applied for Medicaid at yourtexasbenefits.com for your child?
No.
You want to do that?
Okay.
And pray that he gets approved by January. Unfortunately, they're just backed up. You know, they can only process. There's human beings looking at this stuff, and you'll get a letter in the mail. But in the meantime, the best option for a physical, for a physical, there's a lot of places, you know, that will offer physicals at your school.
Mm-hmm.
But
Okay.
as far as insurance, some short-term health plans will cover everything but athletics. Some won't cover athletics. So you got to watch that. And then there's, of course, the Christian healthcare sharing ministry programs, but a 15-year-old can't be on their own program.
Yeah. Okay. Thank you.
Michael, I see you have your hand up.
Yes, sir. I wanted to ask about TRICARE.
Great question. Paul, where's Paul? Yeah. TRICARE is an awesome program, and it is fabulous. It has a network of doctors and hospitals that vary by where you live. And thank you for your service. If you are TRICARE eligible, you are not eligible for a plan through the Affordable Care Act. But that may be a good thing. All right. It's probably a good thing. You'd have a network of doctors and hospitals across the country. Depending upon your service time and location, you may be qualified for the VA drug benefit. In a few locations in Dallas, Fort Worth, where are you located?
I'm in Allen.
Yeah, you know, there's the Plano location there off of 15th and Coit. Not taking, oh, thank you. Paul just said that they're not taking new people. Well, the TRICARE network, it's good. If it's available, you ought to apply.
When you turn 65, well, the month before the month you turn 65, you have to go on to Medicare. And last year I added the Medicare plan for you have to have A and B, and I added the benefits plan that doesn't cover medication because TRICARE continues to cover medication.
Correct.
So that's a no-cost plan. And will that change next year?
Well, you know, I'm not going to say it won't because it's changing so rapidly, but I don't feel it will end. There will still be Medicare Advantage plans that do not have a premium, that do not have a drug benefit to it, that you can incorporate with the different plans like TRICARE that do have, that you can apply for separately. The plans themselves, the Medicare Advantage plans, they are going to change. You out of pocket, generally, an out-of-pocket medical expense risk on a Medicare Advantage plan. They keep the premium $0 to $20 for an HMO plan, but the out-of-pocket expense risk goes up by about $500 a year. And I don't, so, you know, but still under TRICARE, you know, if you use the providers in the TRICARE network, it's a great option.
Yes, TRICARE became the supplement.
Yeah, it's well, it's not exactly a Medicare supplement. It's a Medicare Advantage plan, but it supplements your, and again, we're into linguistics, sorry, but it's supplementing your Medicare Part A and Part B and your TRICARE.
And dental.
Anybody else? Do I need to ring the bell again? It is.
Thank you.
All right.
All right. If we're sort of running out of time here, Mike will be with us at lunchtime. So if you want to talk to Mike at lunch, welcome to join us. Otherwise, his contact information will be in the slide deck. You can reach out to him after August 1 and talk with him, and he can help you do that. Next week, we're going to do open forum. So we'll talk about whatever questions you have in your job search. That away. Let's see here. This recording will be up on the Career USA YouTube channel. Click on playlist. Every video goes into a playlist. Select the North Dallas Plano Career Focus Group speakers. And when you do that, it'll become a list of all the different speakers and stuff. It'll be up probably by tomorrow afternoon. Next Tuesday, being the 5th Tuesday of the month, we only have 4 regular LinkedIn speakers. So this week, we've got a special speaker, Lynn Williams. If you follow her on LinkedIn, she weekly posts some really great articles about LinkedIn and how to use it. And she'll be talking about how to develop successful job search strategies for job seekers. So come join us Tuesday at 1 o'clock. Next Wednesday, the practice interview team will be meeting in person. They meet in person on the 1st, 2nd, 3rd, and 5th Wednesday of the month. For those of you who cannot meet with them in person, we are starting for the next few months. You can join us online. And this week, we're recommending people watch session 1, Preparing to be Interviewed, How Employment Recruiting Works and Developing Interview Tools. The link to get to that will be on the Career DFW or Career USA calendar. Just click on the very front page. On the very front page, you'll see that link for that. Next Friday, we'll do open forum. We'll talk about whatever it is you want to talk about. And then coming up in 2 weeks, Paul Asanoff will be here to talk about the truth about cover letters, personal statements. What you don't know can hurt you, and what you do know can help you. So that should be a really interesting presentation. Come join us today at Country Burger. How many people think they're going to go so we know how big table to get? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 10, 12 people. Go to the very back, put a bunch of tables together. It'd be great, whoever gets there first. So thank you, everybody, for joining us today. Have a great weekend, and we will see you all next Friday.
Thanks, Jeff.
Thank you, Jeff.